really appreciate everybody who was in the waiting room, even long before it was 7 p.m. We appreciate that. We appreciate that promptness. Thank you, everyone, for joining us. Dr. Nina, you're welcome. Okay, so I'm waiting for messages in the chat box so that I can confirm that you can hear me. I'm waiting for messages telling me where you're connected from, where you're joining us from, and then we will be good to go.
I think when is your time to talk?
Okay, thank you once again for joining. Thank you, thank you, thank you, thank you, thank you. Now it is time. The long-awaited program. This is something that we've been talking about for weeks on ending, and all the customized flyers I've been seeing running around is something that I'm super happy about, something that I'm proud to have been associated with. You're all welcome to this mental health program. A bit of housekeeping, right? This program is supposed to last for about an hour and 30 minutes. And it is totally okay to leave messages in the chat box, to document as many questions as you have, especially as the speakers begin to give their presentations. It is totally okay if you want to air your opinions, if you want to air your views, you would have the time to be able to speak and tell us. But why are we here? For some of us who may not already be aware, this is a mental health symposium that is proudly organized by PUWI. PUWI is Prime Unique Women Initiative. Prime Unique Women Initiative is a non-governmental organization, an NGO that is solely focused on women empowerment, on capacity building, especially as it relates to women and young girls. And for a couple of years, we've been solely dedicated to the empowerment of women, with the intention of helping them to become better versions of themselves. And of course, as you may already expect, this empowerment usually transcends to helping children, to helping men, to helping girls, to helping the nation as a whole to develop. But who is this PUWI? Who is Prime Unique Women Initiative? What are we passionate about? If you can see the slides, you will notice that we have several thematic areas. Our thematic areas are solely focused on women empowerment, on skill development, on developmental awareness and peace building, and of course, on quality healthcare, quality education. For a couple of years, we've organized programs, we've organized webinars, workshops, interactive programs, both local and international programs that has helped people to be able to learn skills, to be able to learn valuable skills, both soft skills and hard skills that can help them to become better versions of themselves. So for a couple of years, we've partnered with governmental organizations, we've partnered with non-governmental organizations, all in an effort to be able to help people to learn the valuable skills that will help them to be able to give back to society as well. Prime Unique Women Initiative is a not-for-profit organization. That is to say that our sole aim, our focus is not on making money. Our focus is on touching lives. And proudly, with God's help, we have been able to successfully empower the lives of so many women and young girls. And with God's help, we continue to do more. Our vision is to empower more women for nation building. And we're on a mission to build a sustainable platform for women development and security through capacity and empowerment. Here are some of our objectives as a non-governmental organization. We're solely focused on the education of women and youth so that they can become self-reliant. We organize conferences, we organize workshops and seminars to model and simulate socioeconomic phenomena and allied issues. So we bring most of these things into fruition. We inculcate security awareness culture into women and young people, especially young girls. We carry out rehabilitation and sensitization programs, and we hold peace building and security intervention programs, peace development, business development programs, international women development programs, and all of those on both local level and international levels. Some of our programs hold virtually on Zoom, for example, like this one that you're benefiting from freely. And then some of our other programs hold on site at our office at strategic locations in different geopolitical zones in Nigeria, and of course, in different parts of Africa and the globe by extension. In past couple of years, we've partnered with governmental organizations such as the Federal Ministry of Women Affairs. We've partnered with private institutions like PUWI Health Limited. We've partnered with private organizations such as Sky High Security and Safety and Skills Limited. I've also partnered with other governmental organizations such as the NDLEA, such as NAFDAC, and so on and so forth. Most of the things that we have done, like we have explained earlier, is in a bid to touch lives. It's in a bid to empower people. It's in a bid to empower women, to empower youth, to empower young girls, to help them to become more confident people, to help them to believe in themselves, and to help them to become as independent as possible. Because if we're being sincere with ourselves, there's only so little that the government can actually do for its people. But when more people are empowered, there is more that each person can do for himself. And as he extends it to other people, everyone benefits. Together, everybody achieves more. But if we're being truthful to ourselves, we realize that not even 10% of all of these things that we've achieved would be possible without the efforts of the president and founder who has even brought these ideas into fruition. The person who goes all out, who goes above and beyond, who serves as a mother to these women and young girls, who continues to empower people, who continues to provide even the resources to make most of these things possible. I'm talking about Dr. Folake Yoba. She is the president and the founder of Prime Unique Women Initiative. She even bettered this mental health webinar because she has seen that there is a growing need for more people to be sensitized on mental health issues. The truth of the matter is the number of people who are receiving help, whether psychological or emotional support for mental health, when compared to the ratio of people who are actually mentally ill or who actually deserve mental help, is actually a far cry. There is a far distinction between the ratio of people who are receiving that help to the number of people who actually need that help. And so she is trying to bridge the gap with initiatives such as this, with sensitization programs such as this, to help more people understand, to avoid the stigma that's associated with mental health, to let people understand that they can own up to depression and say, yes, I am actually depressed. To help people understand that people can own up and say, I have anxiety disorder, that doesn't make me mad. To help people know that when they need help, they can speak up without facing fear of stigmatization, and to help more people know that for people who are bold enough to, courageous enough to speak up, that they do not have to stigmatize them. They do not have to distance themselves from them. Everyone needs to embrace this scourge and fight it because it's our common enemy. The person I'm talking about is Dr. Folake Yoba. And of course, I can go on and on to continue to talk about the vision that she has as it relates to mental health awareness, the vision that she has as it relates to business development, sensitization programs, empowerment for women, for nation building, for capacity building. But then since she's on the call, it would only be best that we allow her speak for herself and welcome you all once again. Once again, I welcome you all. Dr. Folake Yoba, please.
Okay, I think you can hear me now. Good evening, everyone. We're happy to have you on this platform this evening because it's important that we all spare time to handle a matter that's as serious as this. I don't think there's any better time than now to talk about, to discuss, and to see how to tackle this problem that we have. It's a global problem, really, but we are Nigerians, and the more mentally stable people we have around us, the better for all of us. So we should not we shouldn't feel that it's not our business, because as a matter of fact, when we talk about mental health, we are not talking of mental illness. Mental health is very broad. Yes, it will take us mental illness and other subtopics under it, no doubt about that. But it's something that we really need to look at and pay attention to. If you go into research, go online and find out, WHO, World Health Organization, has said that over 50 million Nigerians actually have mental illness. I don't know, look at the fraction. And many people who have mental illnesses don't even know they do have. it is when it gets to the extreme that you see people on the streets, maybe, naked or whatever, but people manage situations unknown to themselves, fighting back mental illness. Any part of the body can actually be ill. That's the truth. So if you have any problem, if anybody has any problem, any mental problem, it's not anything totally. I don't know where that sound is coming from, but please help us mute Felix. So that is why we have found it so germane that we should come up with this program now, and let us see how we can mobilize people to actually be able to benefit from this. And we are going to have with us specialists regularly. And then we want people to be able to speak out and look for solutions to the problems they have. We also want people to be able to look around them. Families, mothers should look at the children, your neighbors. Do you notice anything that we think should actually, people that should be helped? Because if you look at statistics of all the, maybe security challenges that we have around us today, most of these are actually attributed to mental form of issues. Like we've seen where husbands kill their wives, and maybe wives killing husbands. People who profess to love one another at some point are now enemies. They may just be as a result of mental issues unknown to them. So it is important that all of us will see this as something that is happening at this particular time. And because of this, we have in-house with us some people who actually have good knowledge about what mental health is all about. What do we do? What do we expect to see? How do we know if somebody has mental challenges? And how do we look at ourselves too, to be sure that we don't fall into this category of people that WHO mentioned, unconscious or unknown to us? Because we have realized that if you have a passion for something that is inordinate, you could actually be battling with mental issues. If you take what does not belong to you in a very greedy manner, not considering others, you could be managing a mental issue unknown to you. So at this minute, I'm going to call on one of our sisters who is actually based in Canada. She's Mrs. Moturayo. I hope you are in house, my sister, Mrs. I'm trying to check if I think I saw her inside. Yes, Mrs. Moturayo. Raji, you are here. Okay, please. Okay, please. I want you to... Oh, yes, Mrs. Moturayo Raji. Yes, I was trying to locate you here, but now you're here.
Yes.
Let us give her the next 10-15 minutes to see how she will explain to us based on her experience working in hospitals in Canada and her experience as a nurse. Please, let's welcome Mrs. Raji. Okay. Thank you.
Okay. Good evening, everyone. For the purpose of this presentation, because mental health is a very wide topic, so I'm going to streamline it to the very important aspects in our society that is causing a kind of violence, that is making people to kill each other, that is causing domestic violence, that is making it difficult for people to relate with each other in the society. Because it's a very broad topic, I'm actually not going to talk deep about mental illness. The popular one we know about that we call madness. People who have, who have completely lost it. That's not what we're going to talk about tonight. We're going to talk about the behavioral aspects, certain behaviors that we or people around us exhibit that we take for granted, and not knowing these people are suffering from a kind of behavioral disorder, which is also a form of mental illness. To start with, what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also helps us to determine how we handle stress, how we relate to other people around us, and how we make healthy choices. Mental health is very important at every stage of our life, from childhood, adolescence, and through adulthood. Now, is it common? Yes. Mental health issues, I'm not going to say mental illness. Mental health issues, disorders are very common. In fact, just like you said, 1 in 5 people suffer from mental health issue. And it's so funny that a lot of these people, it could be us, it could be people around us. We look at them, we don't know they are sick because the signs are so subtle. We don't even realize it. We can't, it could be me, it could be any of us that is sick, but we don't know it because we are not, the only mental illness we know, especially in Nigeria, is when we say somebody is mad. But we are not talking about madness. We are talking of a kind of behavioral disorder. Now, how do we know that we are suffering from mental health issue? How do we know? Before I go into how do we know, what are the causes? What can cause us? What do we think is the cause of these mental health issues? Number 1, it could be genetic. Some people inherit certain kind of behavioral disorder that run in families. I still maintain I'm not talking about the madness. Sometimes it's use of drugs, recreational drugs. Sometimes certain traumatic experience in life, our capacity to handle stress and life events or life situation differs. So if we are not able, some people have some trauma that make them to have a form of mental disorder. Then sometimes it could just be that we allow things to just, for example, you did not seek help at the right time. When maybe you suffer trauma, it could be the children, it could be us. Like, for example, going to a therapist is not common in Nigeria. Though I'm not saying they don't do it in Nigeria, but it's not something we take very important. Unlike in developed countries, when people lose maybe a mother or a father or parents or siblings, they take them for therapy so that they can get out of it. But in Nigeria, we don't count it as something very important. And this trauma lingers for long, and that person can eventually develop mental health disorder. Now, let's look at certain behavior that people exhibit. I'm not saying that from after this, we should start looking at everybody from what I'm going to say. I'm just giving an example. When it becomes excessive, there's certain things that when it becomes too, they say TOO, too is a fault. When it becomes too much, it becomes, something is wrong. For example, excessive, when you see somebody like is talking about something too much, we call it boasting. You see somebody will come and tell you about finances, he will come and tell you he's very rich, he's expecting a contract, he's going to come tomorrow. This person is exhibiting this behavior continue. It could be our husband, it could be our brother, it could be our sister. They are not living in reality. This person keeps talking about this and you see that it didn't happen. I've seen this as a very practical example. It happened to somebody I know. This person come and people will just laugh over it. We say, look at him, that's how he used to talk, Joe. And you know it, that this what this person is saying is a lie. And this person continues to exhibit this symptom. Another time he will tell you, oh, he's having a contract that is coming. Finance is it's usually a very important aspect. Like she mentioned now, like taking something that doesn't belong to you, like stealing. Maybe you are in a position in the office, then you have the ability, you are positioned to, to handle the finance of that of the office. Then you now embezzle the money. That's a form of mental illness, but we take it for granted. The person is sick, he's hoarding, he's keeping something because of fear that tomorrow he may not have that thing. It's a form of illness. Then somebody is boasting, keep talking about something. In Nigeria, we laugh about it. We don't say, that's how this one used to talk. But that person is sick because these people, it's come to a stage. Maybe he has been saying it, then one day we look for escape route. And in the way of looking for escape route, it can harm an individual, somebody very close to us. That's one aspect. Then excessive anger. When somebody has excessive anger, we are all human beings, we get angry. But when your anger is too much that we cannot control it, everybody is talking to you, and it's repetitive. This person is always getting angry all the time, and the anger is too excessive. Please, I'm not saying that when somebody gets angry in our home, we not say the person, no, that's not what I meant. No, but when it becomes too excessive, beyond control, that could be a sign of mental illness. Isolation, when somebody is isolating him or herself too much, it can start from the children. You see them, they isolate themselves. They don't want to come out of their rooms. Sometimes they lock themselves inside. They are not talking to their friends. They don't want to associate with friends. That could be a sign of mental illness. Then you see somebody, the person is always, today the person is high, tomorrow the person is low. You see that mood swing. It could be us, it could be, I'm not saying we all get moody. There are days we are not happy. There are days we are not in a good mood. But when it is repetitive, when it's always happening, that could be a sign of mental illness. Poor hygiene, when somebody cannot take care of somebody, you can't take care of yourself. But for the person to bath, for the person to even common basic things, taking care of yourself, it could also be a sign of mental. I'm not saying in all cases, but these are the things we should watch out for. It could be us, it could be our children, it could be any family member, it could be neighbor. You see that your neighbor is not going out, it's not dressed, it's just doing him or herself anyhow, and it's doing it continuously. Something is wrong with that person. That could be a sign of mental illness. Extremists, when we become extremists, mostly it's in religion. Extremists in religion, that you cannot even tolerate another person talking about another religion. When it becomes too much, it could be a sign of mental illness. Then when you see somebody that the person is living in fear, there are people like that, they live in fear. Sometimes, even when they go out, maybe they see a large space, they'll be so scared, they can't, it has a terminology in mental illness. I'm not going to bother you with that. Fear of space, fear of crowd, of even staying among people, fear of water, of seeing a water, stream, river. There are several fears. When somebody is not, is afraid of spaces and certain things, it can even be mountain. That could be a sign of mental illness. It's a lot. I'm paranoid. When somebody is paranoid, the person feels that any little thing somebody say, oh, she's talking about me. It's me, Mrs. Solake Mrs. Yoba was talking about. Look at the way she said that thing. It's because of what I said these days. There are people like that. You cannot even talk. You can't talk around them. So that could be a sign of mental illness. It's a lot. I'm not going to bother us, but I just want us to look at these basic signs and symptoms to make us recognize when it becomes persistent and it's too much, we should notice it. Then in children, because these things sometimes it starts from childhood. In children, the most common one is when you see your child start isolating him or herself, not talking with the peers. It's always sad, it's always moody, and you should watch it. Something is wrong when it's present. Or when your child can be defiant, you say something, it will say it back at you. You start wondering, what's wrong? What has become of this child? I'm talking, you are talking back at me. What's wrong with you? Then the next thing, you start beating that child. No, that's not the solution. Maybe this is a new development from your child. He doesn't do that before. Then suddenly you start talking back at you. Then anything you said the child should do, we call such children defiant. Anything you say they should do, they will oppose it. That is not, that child is suffering. Something is wrong. Seek for help when you see all these signs in your children. Don't start beating the children. Don't ignore it. It could even be our friend. It could be our neighbor. They come to us. Oh, I don't know what's wrong with this child. All of a sudden, they start talking back at me, talking to me anyhow. And the child kept doing it. That child should go and see a therapist. Maybe a therapist will recognize that, oh, there is need for treatment. Then that child should go for treatment. Or when the child is always locking him or herself up, doesn't want to associate with his peers and friends, please check that child. Something is wrong. Then in our homes, in our marriages, we hear partner domestic violence, another partner killing another partner. Sometimes they are suffering from mental illness. So when you see somebody having a sort of verbal outburst, and which it's always shouting, fighting, talking, I understand frustration can lead into it. We are all frustrated. The economy is bad. Everybody is not happy. But as human beings, we should have the mental capacity to handle stress. If we are no longer able to handle it, and it's affecting our relationship with other people, with our partner, with elder family member, with everybody, then something is wrong. Something is wrong. Please, we should know that this is a sign this person needs help. Then another sign is there are people, they find it difficult to keep a job. Or they will tell you, oh, I'm going to do for work today. They will come back, oh, I can't work in this. Everywhere, it's always having problem. Everywhere they go, there's always problem. That inability to keep a job is showing something is wrong with this person. There's a pattern. Everywhere this person go, they must sack this person. So every employer cannot be bad. This person, something is wrong. And sometimes we say it's laziness. Sometimes it's not laziness. This person might be suffering from a form of mental health disorder. So we should look at this sign, but I'm not saying we should be judgmental. Any little thing, say, oh, it's not mental illness. No, but when it becomes persistent over a period of time, 6 months, 1 year, and we should not overlook it. We should look at this as a form of mental health disorder. Then I've spoken about the behavioral aspect. Now we also have the illness, the main mental health illness. I didn't want to go into it, but let's quickly go into it. Why I want to go into this is to enable us to seek for help when we need. For example, depression. Depression is very common. And most of the time, it could be genetic. It runs in some family. Sometimes, like I mentioned earlier, it could be trauma. You had a traumatic experience, then you can become depressed. The signs of depression is isolation, sadness, the child or whoever is always sad. It's always sad. When in such cases, they need treatment, because if you don't treat depression is what we go into what we call madness. Because if you leave it and you don't treat it, the person will eventually develop, in most cases, some cases don't go into schizophrenia, which we call madness. But in most cases, if you don't treat depression, it can make the person to have what we call a psychotic episode, whereby the person will break completely for reality. That's when you see them, they start laughing. Because why are they laughing? They are seeing things. It's hallucination. They see things, they hear things, they smell things. You are wondering, why is this person laughing? The person is laughing because the person is not in the real world. The person is seeing something you are not seeing. Somebody is talking to them. You are not seeing. That is what we call madness. So it starts from depression. The person starts having signs. When you feel sad, you can't control that sadness. And it's with all excessive worry. You worry over unnecessary things. We all worry. We all get worried about certain things. But when it becomes too excessive that you can't control it, it could be us. It could be sometimes talking to a therapist can help you to take care of your excessive worry. But when the worry has become that any worry that you are not able to sleep for 2-3 days, 1 week, no, you should seek for help, go for treatment. Something is wrong. Sometimes the doctor can just say, okay, maybe you had anything. Usually it starts from lack of sleep. If you are not able to sleep, you are not able to sleep continuously 3 days, 4 days, up 5 days, something is wrong. That could be the very first sign of mental illness. Let's watch for it. Sometimes it's so common with our children. Most parents, they dismiss it because they say they are playing game. Oh, that's how they do. They like to play game. They play game. Don't they have their sense that it's time to sleep? It's past midnight. Your children are always playing game. They play game into the night. They play game 4 a.m. Every day it becomes a pattern. Please, let's check it, because if we don't check it, it goes into something very bad. We can hurt ourselves. We can hurt other people. These children there are instances of children who are mentally ill that have killed their parents. They've killed their siblings, they've killed their parents. There are instances of adults who are mentally ill that they have killed their partners. So it is very important for us to watch this subtle sign of mental illness. It's a very broad topic. We can't touch every area. So if you have any question, you are free to ask. Thank you.
Thank you so much. Thank you so much, Mrs. Raji. We quite appreciate you. Mrs. Raji is actually a nurse based in Canada, and she has BS in nursing, and she has been privileged to work in so many hospitals with handling mental wellness. That's why she's very appropriate to open this program for us. And I'm sure we have learned a lot from this. Like she said, we cannot exhaust everything today. And this program is fortnightly. So we'll still have other people to talk, and we still have other things to talk about, no doubt about that. But why I believe that people should believe in this program, and as many of us that can do this, Nigerians, the world will be better for it, as a matter of fact, because this is a big problem. It's indeed a menace, and nobody's paying attention to it. That's the most unfortunate side. And we in PUWI, because we believe in the welfare of everybody, particularly women, because it's popularly said that if you train a woman, you have trained a nation. So we believe that if women should get to understand what we're saying, they can touch on in the lives of their family members, their husbands, their children. And that's why we are calling out women to be part of this program. And we are not limiting to women anyway. I'm sure men are in-house here, and we appreciate men being part of what we do. It's very important. So now I'm going to call on a very wonderful speaker as well, a man who has been part of many of our programs, particularly when we have in Turkey. He's always there, and everybody enjoys his part every time. He's a very, very wonderful speaker. And I'm sure many people who have been part of his lectures out of Nigeria will be glad to see him here. He's an international speaker, he's a wellness coach, he's an emotional intelligence expert, and he has so many qualifications. Yes, I want to call on Professor Tariq now. Please, Prof, are you in house? Please, can you take over the mic?
Yeah.
Okay, thank you so much. Let's have you.
Can you hear me? Oh, yes, okay. So,
we can hear you, Prof. We can hear you.
All right. I just want to see the video, to start the video. I don't know. Okay, start my video. Okay, what's wrong? Sorry for that. I don't know that my camera is not working. I don't know why. All right. Shall I start?
Please go ahead, Prof. You can hear
Okay,
you.
all right. Sorry for this camera thing. You know, I will start with a question for everybody. Are your thought processes creating guilt, pride, resentment, anger, regret, or self-pity? Then you are not only reinforcing a false sense of self, but also helping to accelerate your body's aging process by creating an accumulation of past in your psyche. And remember, if we dwindle much in the past, you know, we start having depression. And if we think much of the future, we feel this sense of anxiety. So what is the solution is to focus on the present moment. The present moment is the only moment we really have. So you have to verify this for yourself by observing those around you who have a strong tendency to hold on to the past. And this actually is a reason for many problems and discontent, unease, tension, unnecessary judgment, resistance to what it is, and denial of the now. See, so many of us, you know, are in denial of the now. And this is the point I need to focus on. In fact, we should live the present moment. We should relate everything to the present moment, not to the past and not to the future. But does not mean we shouldn't plan. No, we can plan. Now, anything unconscious dissolves when you shine the light of consciousness on it, when you are aware of the present moment, when you are aware of what you're doing, when you are aware of the blessings you have, you know, when you stop worrying or you stop thinking of the illness, of the past, the sad past memories in the past, or what you need to achieve in the future. Because most of us, you know, actually live in a waiting process. We always wait and wait and wait for what, for tomorrow, for next month, for next year, and for things to happen. And meanwhile, we forget to live. And this is a big problem, and this is the cause of depression. So waiting is a state of mind. Basically, it means that you want the future. You do not want the present. And this is the point that I need to emphasize. You see, you need the future. You don't need the present. You don't want what you've got. You want what you haven't got. And with every kind of waiting, you unconsciously create inner conflict between your here and now, where you don't want to be, and the projected future where you want to be. You see, so you hate the present moment. You hate what you are in now. You're waiting. You see, waiting and waiting, and this and you know, and this starts you know, depression, and also is one of the causes of our mental health, because we are in self-denial. Now, you need to give up waiting as a state of mind. This is the point. You need to stop waiting. Live your life, lead your life, live the present moment. Why you wait for? What are you waiting for? So when you catch yourself slipping into waiting, snap out of it. Come into the present moment. Just be, enjoy being. So if you are present, there is never any need for you to wait for anything, because you are enjoying the present moment. And this is the cause of many problems, many mental health problems, is that we are, we don't want our present moment. We hate what we are in. We are not happy with our partners, or our even classmates or job mates or colleagues. You see, and this causes the problem. So next time somebody says, sorry to have kept you waiting, you can reply, that's all right. I wasn't waiting. I was just standing here enjoying myself, enjoy in myself. You see, this is another way of looking at, waiting. So we need also to observe the resistance within yourself. Observe the attachment to your pain. Some of us, are very attached to their pain, to the limit that they identify themselves with pain. They become pain. And whenever they are in a state of happiness, or they enjoy or whatever, they think that something wrong. Why I'm happy? Why I'm enjoying myself? Something wrong. I should be in pain. This is not right. Why? Because they identify themselves with pain. You see the point? So you observe also the peculiar pleasure you derive from being unhappy. You see? So remember, pleasure. You derive pleasure from being unhappy. Some people, get pleasure when they are unhappy. When they are happy, they are not satisfied. You see? Observe the compulsion to talk or think about it. The resistance will cease if you make it conscious. If you think about the present moment and bring things in front of your eyes. This is the ABC of any solution. You have to be aware of it, not in self-denial. So you can then take your attention into the pain body, stay present as the witness, and so and initiate its transmutation. You see the point? Now, to suddenly see that you are or have been attached to your pain can be quite a shocking realization. The moment you realize this, you have broken the attachment. So you need to realize that you are attached to your pain. No, you should break that attachment and start living by focusing on the present moment. And I'm sure, you see, God is fair, and life is fair. Everybody of us has something to be happy about. And we are all grateful to many blessings. You can count your blessings. You have to feel grateful to what you have. Don't think of what you have not got. Think of what you have got. So, and also I would like to talk about another point, which is the addiction, because when you are in pain, when you are in a mental health, you resort to addiction. Actually, every addiction arises from an unconscious refusal to face and move through your own pain. So you remember I said self-denial. So every addiction starts with pain and ends with pain, because people think that if we are addicted to drugs, to you know drinking or whatever, they will be okay and they will feel ecstasy, or they will you see, actually answer the problems, they will solve the problems. But in fact, they double the problem. So whenever the substance you are addicted to, alcohol, food, legal or illegal drugs, or a person, maybe sometimes we are attached to a person or we're addicted to a person, you are using something or somebody to cover up your pain. That's why after the initial euphoria has passed, there's so much unhappiness, so much pain in intimate relationship. You see? So they do not cause pain and happiness. They bring out the pain and unhappiness that is already in you. So every addiction does that. You see, every addiction reaches a point where it does not work for you anymore. And then you feel the pain more intensely than ever. Okay. So first, you stop judging yourself. We need to stop judging ourselves. You stop judging your partner. So the greatest catalyst for change in a relationship is complete acceptance of your partner as he or she is, okay? Without needing to judge or change them in any way. You know, this is actually, it doesn't, it never happens that, okay, I'm gonna change my partner or I'm gonna change my wife. It never happens. So we have to, you see, accept them, and we need to not to judge them, you know. That immediately takes you beyond ego. All mind games and all addictive clinging are then over. There are no victims, you see. All right, what else I would like to talk to you about is whenever you feel negativity arising within you, whether caused by external factor, a thought, or even nothing in particular that you are aware of, look on it as a voice saying, attention, here and now, wake up, get out of your mind, be present. So you need to be a watcher of what's going on inside your mind. You know, you have to control what's going on in your mind, and you have to be present. You have to be aware of what's going on, and you have to resist, you know, the radio. You know, we call it, sometimes we call it the I call it also the music, you know, the music running into your mind. And of course, this music always brings in sadness, brings in fear, brings in, some bad things you expect in future. You know, we have to stop worrying. You have to stop worrying about the radio going on inside your mind. You need to control that. You need to be a watcher of what's going on in your mind. You have to be in control. You see what I mean? So another thing, we need to forgive yourself for not being at peace. The moment you completely accept your non-peace becomes transmuted into peace. Anything you accept fully will get you there, will take you into peace. This is the miracle of surrender. So when you accept what it is, every moment is the best moment. That is enlightenment. You know what I mean? All right. So when there is no way out, is still always a way through. So don't turn away from the pain. Face it, feel it fully, feel it. Don't think about it. Express it if necessary, but don't create a script in your mind around it. Give all your attention to the feeling, not to the person, event, or situation that seems to have caused it. And I remember, you know, I always tell in my lectures that, you see, we need to be soft on the people, hard on the problem. You got it? So you have to be soft on yourself. So don't let the mind use the pain to create a victim identity for yourself out of it. Feeling sorry for yourself and telling others your story will keep you stuck in suffering. So since it is impossible to get away from the feeling, the only possibility of change is to move into it. Otherwise, nothing will shift. So give your complete attention to what you feel.
Okay, Prof, can you hear me, Prof? Professor Tari, can you hear me? Okay. Like we lost him, I don't know. But I think we've heard a lot from him, and then we also move forward. You can see come back, and we expect that some people will have questions.
You cannot hear me.
Oh, yes, we can hear you now.
Oh, so you lost some part of it? Oh my God.
Yes.
Oh, that's bad.
But never mind. You can still go on. Just go.
No, actually, I need to tackle one last problem. Is, you see, we need to. There is a dragon raging inside you. It has a name. You know what is the name? It is self-doubt. So you are the only one who can see it. So you are the only one who can slay it. You know, you can slay it. You have two choices. You either learn to slay this beast, or it will slowly and silently slay you. So you have to slay the dragon inside your mind, which has all the fear, all the bad memories, all the sad moments, all the the dark future, all the pain, all the depression. So you need to slay that dragon, and start living. And you need to relate everything to the present moment. So this is what I would like to say today. Relate everything to the present moment. Don't dwindle much in the past, okay? And don't live yourself in waiting, and you forget to live the present moment. I'm ready for any question, Dr. Yoba.
Okay, thank you so much, Prof. Please, participants, please take note of your questions. Then we'll soon get to question and answer session so that we don't get rowdy. Right now, I want to call on. Thank you so much, Prof. We always appreciate you.
Thank you.
We really appreciate you.
No problem.
Please, we still need more of your time because there may be questions for you, please, if you don't mind.
Okay, no problem.
Okay, fine. Yeah, right now I want to call on the last speaker for this evening, and that's Barrister Nena. Barrister Nina is actually a lawyer for over 10 years, and she's done a lot of advocacy. She's been involved in trying to make things better for people. She has been to correctional centers. She has offered practical solutions to people's crises and so on. And I know she's going to give us a home view, considering the fact that she has met with so many people who have suffered from mental illnesses, who have mental health situations, and she has a lot to tell us. Barrister, are you in house, please?
Yes, I'm here. Good evening.
Okay. Good evening, Barrister. Please take the floor. Thank you.
Okay, Felix, please, can you share my slide? Okay, so we've spoken a lot about mental health, and so we just have to look into the legal part of it. So next slide, please. So we're here to understand the legal framework surrounding mental health issues, access to mental health services, individuals' rights, the effect of public perception, and the intersection between our mental health and crime. Next slide. So legal framework, as we know, we have the National Mental Health Policy of 1991 and the Mental Health Act of 2013. We also have the International Human Rights Instrument, of which Nigeria is a signatory to not just that, but various international human rights treaties that affirm the right to health and the right of persons with mental health conditions like depression and the rest of them. Next slide. So what are my mental health rights? So I want to tell you that every person who has mental health issue, they have the right to be treated, right to therapy, right to consultation, and the rest of that. So what are my mental health rights? One of my mental health rights is right to informed consent. The patient have right to receive clear and understandable information about their mental rights condition. So you see me walking into a clinic or a hospital, and I want to talk to the doctor about my mental health, depression, and the rest of that. And you see that one of the rights every human being has is that that doctor should be able to tell me what is wrong with me, should be able to tell me my mental health situation. And based on that information that the healthcare providers has given me, I would have, I'll be able to have information of which I will know whether I want to proceed with the treatment or not. So I have right to privacy and confidentiality. So if someone walks into the hospital and start telling the doctor about their mental health issues, it is the right of that person to be protected. Like we have the data protection law everywhere is universal. Even Nigeria, they have their data protection law, that such hospitals, such clinic do not have the right to expose the situation or the degree of my mental health challenges. But what do we have? You see people almost saying, you enter into hospitals and you see some of the nurses saying to another nurse something like, please take her to the mental health section. You know, such thing, I believe that nurses should be trained on how to keep private information confidential. So you have the right to complain and you have the right to redress. Next, please. So you have the right to quality care. The patient have the right to receive quality mental care that meet professional standard, delivered with competence, compassion, and respect for their dignity. It needs to be provided timely, effective, appropriate care to them, regardless of their socio-economic status, regardless of their religion and other characteristics. So you also have the right to refuse treatment. If you think the treatment does not go well with you, you also have the right to say, no, I don't want my treatment like this, or I want this kind of professional to treat me, or I want this kind of gender to treat me. So you have the right to refuse treatment or to accept treatment. So you have the right to access healthcare services without discrimination, without barrier, without obstacle. So what are the ethical principles expected in, go back to that slide, please. What are the ethical principles expected? Next slide, please. Felix, are you there? Next. What are the ethical principles expected in addition to our mental health right? Go on. So veracity, I want you to tell me the truth. If I come to you and you're a health professional, I want you to be honest with me. So this includes providing accurate information about treatment options, about the risk, about the degree of my mental health, the stages. And if you're not telling me the stage I am with my mental health, I might not know I am going deeper, because this mental health issue, some of us, it's something you don't even know when it starts happening to you. So you don't even know when you slip into depression. You don't know. So when you talk to these professionals and they ask you questions of your daily activities, so they know the degree at which these things are growing into. So it is your responsibility or their responsibility to tell you the truth, to be honest with you. So they owe you a duty to act in your best interest and to prioritize your mental health welfare above other considerations. This include maintaining professional boundaries also. So they have respect for autonomy. Patients have the right to make their own decisions about their health care. Compassion and empathy. Mental health care providers should demonstrate compassion, empathy, sensitivity towards patients in recognizing their suffering, their fears, their vulnerabilities, listening to them, validating all their experiences. But what we have these days, you go into hospitals, imagine telling a doctor you are depressed, and you see most of these nurses are not even trained. They don't know how to talk to patients. They make even worse. You know, you hear them saying things that will even complicate your health the more. So beneficence, you should help me in every way to promote my well-being, to prevent harm, to alleviate suffering to your best extent possible. So no malfeasance, to minimize the risk of adverse outcome associated with mental health intervention. Justice, integrity, continual education and professionalism. Like I said, these people, these nurses should be trained. I'm sure most time when you go to places and they talk about mental health care, they think you're talking about mad people, you're talking about crazy people. They don't know there are some levels, there are levels of mental health. They don't even know that. The last time I was in correction center, and I was talking to the head of the correction center, and I told them that putting people in jail does not actually bring about deterrence. So you put people in jail and you lock them up in a small hole, and you're not even talking to them. So most time when you go to police station, you realize that some people just need people to talk to them. Some people just need people to counsel them. Some people just need therapy. They don't actually need to be locked up inside a hole without nobody talking to them. I think the essence of correctional service is to keep talking to these people. That's the reason why you see people coming back to prison for the same or exact crime to which they committed, and you're asking yourself, why did this person who just left 2 weeks ago, why is he back to the prison? And you ask this person, are you enjoying this prison? And the person said, no, I'm not enjoying the prison. So the question is, why are you back here? Why do you keep doing the things you were doing or the things you did that brought you back here? So you understand that these things have to do with their mental health. Next slide, please. So the challenges in implementing mental health laws in Africa, we have limited funds. They can't even get professionals. And the next one's the lack of mental health professionals. Even if they get mental health professionals, they can't even pay salary, no facility, and the stigmatization. Then you can't even walk to somebody because of the places the way we place ourselves, because gender-based, we believe men don't cry, men are not supposed to cry. So it is not famous for a man to walk up to someone and say, I'm depressed, I need to talk to someone. We believe men should not cry at all. So our cultural belief also, one of the reasons why we can't even implement all these laws. So they believe something that is happening to a young girl, for instance, if a young girl is forced into marriage, you hear a lot of cases, we have a lot of cases where young girls killed their husbands in some parts of the nation because they were forced into marriage, or because they walked into marriages without understanding what this thing is about. So they couldn't handle the challenges of marriage, and they just need to talk to someone, and there was nobody to talk to. Then you go to your family members, you go to your mother to talk to your mother about this thing, and your mother have this cultural belief. They tell you, oh, you have to stay there. In our culture, women don't leave their home, and if you leave your home, it's a stigma. You know, they talk you back into the same marriage, and they don't even give you listening ears. And this thing affects these young girls. They become aggressive, they become violent, and then you hear news. They call you all the time. They say, Nina, we have a case, and this young girl just murdered the husband. So most of all these things, they just need somebody to talk to, because these things have affected their belief, this cultural belief. They've affected their mind, the misconception, the gender-based, lack of awareness, lack of education, and then the disparities between the urban and rural areas. Then the human rights violations, they just tell you nobody is doing anything about these things. Some people abuse, sexual abuse, they have traumas from their past, and they don't have anybody to talk to. People are not trained on what mental care is about. So you see them committing crime that they are not supposed to commit. Next slide, please. The effect of public perception. So I want you to type in the chat room, what are some of the cultural beliefs that you think has affected or that we can get from public perception that have affected our mind or our mental health? I will give you an instance, spiritual belief. So you see women who are, we have a case where we went to arrest a certain woman in the church. This girl was pregnant. She was supposed to do what we call CS operation. And you know, this spiritual belief, they tell you no, CS is demonic. Our culture says if you do CS, it means you're a wayward lady. You know, most of all these orientations, some societal attitude. And then the girl went back to the church and they started praying. The girl lost so much blood and then she died. You know, she was affected mentally. She doesn't know what to do. She couldn't even go to the hospital. She went back to the spiritual house where they were praying. So all these things. And then when the man heard about what happened to his wife, he went to the church and then with cutlass and then got into fight with this spiritual leader. So all these things, you see, when we talk about too much intersection of mental health and crime, you cannot really remove mental health or the way we judge crime. We cannot disassociate our mental health with crime. That is why we talk about what we call mens rea and autos rea in crime. Mens rea, that's the intention of a particular convict in every crime section. So we understand that most people who commit crime didn't have the intention. Some of them did not have the intention to commit crime, but because of the instability of their mental health at that point in time. Next slide, please. Okay, somebody said religion. Yeah, somebody said religion. I'm going to the chat section. Somebody said religion also have a way of affecting the implementation of these healthcare issues. So the intersection between healthcare and crime, like I said before, there's something we call mens rea and autos rea in the principle of criminal law, particularly regarding the intent and action of individuals, right? So mens rea refer to the mental state or intention behind the commission of crime. It's a crucial element in determining criminal liability because it reflects the culpability or blameworthiness of the accused. So most time, like I told you, I think last week I was in the correction center. Most time people do not have the intention of committing this crime, but because their mind have been affected in a way that they could not control their action. So we saw a woman in prison last week who killed the husband, and then what brought about the issue, she felt he wasn't doing enough. So this brought about fight. She pushed him and he fell. So sometimes the way Prof was talking, and Prof said, stop putting yourself in waiting time. So if the situation is not pleasant for you, there are ways that you can make the moment pleasurable for you. You owe yourself happiness, because if you don't become happy, if you don't find a way to help yourself, you will find yourself not sure that is where you want to be. And when I asked the woman what she wished she had walked away. it can turn back the hand. Cannot turn back the hands of that. There was no school fees, providing feeding money, and then with his wife, which probably was in this economical situation. Why they started fighting. She said she didn't, and he fell and hit his head. Those went to correctional center, we were counseling these people. Different. She said, I wish I can turn back the hands of way. So this mental health issue, we need to, and the most thing we can do is just, next slide, please. And this is actus rea. Actus rea is the physical act. Mens rea is the intention. Sometimes in crime, we want to understand if it is your intention to do what you did. So that woman, it wasn't her intention to kill her husband, but what can we do about it? The law has taken its place. She needs to get in there. I don't know how many years they will give to her, but whether or not you had the intention or not to do what you did, you cannot undo the harm you have caused yourself. You cannot undo the harm you are causing your society and your loved ones. That is why you have to sit down and think. When you start behaving or doing some kind of thing, when you start seeing the symptoms, then you have to call yourself to order. You have to speak to someone. Next slide, please. So competency evaluation, that is what we just talked about. Then involuntary commitment. In Lunacy Act 1958, you will be locked up whether you like it or not. And we don't even know how much time they're going to lock you up, but the law says you will be locked up if you're becoming dangerous to your society. And I'm not sure anybody wants to be locked up. So it is high time to sit down and think about the action, things from your past that is creeping into your future. For some people, they have trust issue because of what has happened in their past, and it's slipping into their relationship because they can't even control their past and their future. So diversion program, they're taking you to mental health home. And then the causations, the vulnerability to victimization. So individuals with severe mental health issue are likely to be victims of crime than perpetrators. So this means that you'll be victim, you can't even think straight. For some people, they are so lonely, it has affected them that they just go into any relationship, any available relationship, and they are extorted. People take this undue advantage of them because at that point, they want somebody to be with them. So what are the symptoms? What are the symptoms? You have persistent sadness, hopelessness, loss of interest, the things that gives you pleasures before, changes in appetite, your sleep disturbance, fatigue, loss of energy, difficulties in concentration, thought of death. Even some people are suicidal, withdrawal from social activity. Once you start thinking, oh, I don't feel like, the I don't feel like kind of thing, you just have to check yourself. I don't feel like going to church. I don't feel like going to work. I feel like I want to resign. I don't feel like working. When this I don't feel like start entering into your daily activities, then you have to start thinking probably something is wrong with my mind. Next slide, please. So you have mild symptom, you are feeling down, you're not able to go to work. What should you do? You start exercising. You start engaging in social contact. Call people. You talk to trusted friends, trusted family members. Then just sleep. You can practice meditation, relaxation. Next slide. So this could be as a result of biological factor. This could be genetic. It could be from family history. It could be some kind of neurochemical imbalance in the brain, like lack of dopamine and serotonin. These things are the things that causes pleasure in human, that causes joy. You see some people, they are just sad. Nothing makes them happy. So those people have imbalance in their neurochemical activities. So we have hormonal changes. You know, that is why you see pregnant women, sometimes they have mood swing, you know, and sometimes traumatic life events such as abuse, things that have happened to you before, you could not talk to anybody about it, and you bottled up. So these things, in your own quiet time, you were just thinking, you think that the next person in your life is like the former person in your life. So the people in your future will bleed on things that happened in the past. You need to talk to people about it. So you begin to have low esteem, a feeling of inadequacy. So these things, anxiety, I'm not good enough, somebody is doing something better than me. So next slide, please. And when you think somebody is doing better than you, it is not the time to be competitive. It is the time to sit down and think about self-development. It is time to reach out to the person, to ask the person, what is this thing that you are doing that I'm not able to do better? So this could also be environmental factor like poverty. It will also be cultural and societal factor. Next slide. This could also be pressure. You know, the society have a way of giving us so much pressure. I don't understand. For instance, somebody might come up and say, I don't want to give birth. I just don't have the time to give birth because I cannot be a good mother. Go and say that to somebody in the society and hear what they will say. They will say you are possessed. You know, they have to take you to church. And then you go into these things, you are depressed. Then the society have what they expect of you. They think at 31, there's this stereotype. They tell you at 31, you're supposed to have built a house. At 35, you're still in your father's house. At 40, you're supposed to be married with 4 kids. I mean, and you're thinking about all these things, and these things begin to affect your mental health. So back to the correctional center. This was where we went to correctional center in Suleja. And I want to ask us a question. Is the simple act of just locking someone up in a small room a deterrent to crime? And I need you to say something at the chat room. We have come to the end of our presentation, but I need to ask you this question. Is the simple act of just locking someone up in a small room a deterrent to crime? They take you up, they put you in prison, and nobody is saying anything to you. And the second question is, why do you think why do convicts keep coming back to prison for the same thing that took them there in the first place? Why do they keep coming back? Because of the same thing they did. If it has to do with mental health, for me, I think for you to lock someone up for 6 years and you're not talking to the person about anything, you just lock the person up. Nobody, no agency is coming to talk to them about their mental health or why they are doing the same thing or why they nearly committed murder and they went out and they commit something else and they came back. For me, I think it is because they don't have a healthy mind. So what do we do? What do we do? What then is a healthy mind? What do we think? It's not just picking people up and throwing them in prison. That will not cause any deterrence. If you don't speak to the mind of these people, they're going to go out there and even commit worse than they had done. So if you want somebody to change, you have to relate, or you have to speak to their mental health. You need them to have a healthy mind. Even our kids, for them to change, for them to change, they need to have a healthy mind. Next slide. So the interventions, seek help from professionals, practice self-compassion, like we said, don't judge yourself too much. Stop being competitive, don't judge yourself, celebrate your little win. If you're not able to be what you want to be, don't worry about it. The difference between here and there is T, and the T stands for time. If you are not getting there now, I promise you, you will get there tomorrow. So you build a support system of trusted allies, establish healthy routine, find something that makes you happy. Set a realistic goal. It's very important. Every goal begins with a step. Little by little, you will get there. So you limit stressors. If you think going to Facebook is going to cause you stress, don't even go there. Because when you enter into all these places, you see that people post fake things a lot. And you're wondering why your own husband hadn't gotten you a car. You're wondering why you've been at one spot for over 15 years. So if you think going into these things will make you see things that will cause you depression, don't even go there. So find something that makes you happy, limit stressors. There are some friends that you will be with and all they do is to stress your mental health. They tell you how they have done this, how they have gotten 200 billion and how they got new cars. If you think those kind of friends are not helping you mentally, you stop going to meet them. Practice mindfulness, spiritual meditation. Thank God for what you have now and pray to him. Thank him for what is coming tomorrow. So you talk to yourself, have affirmation. If Lord, I know if it is not happening to me right now, I know it's going to happen tomorrow. So you have spiritual meditations and you stay connected, seek meaning and purpose. Go to motherless baby home, give them something, find something that gives you meaning. If you go to hospitals and you see the kind of cases we have, people with explosion, people who have pipes going in through their nose, people who are eating, people who can't even survive without them fixing oxygen in their nostrils, then you will have a meaning. You have something to celebrate God for. Let's go to next slide. So community support. Check for people that don't have what to do. Try to give them employment assistance. Then there's something we call CIT. I thank the organizers of this program and I'm going to beg them to collaborate with law enforcement people. Most time they arrest people and they all need to talk to them. They don't need violence. All these people need somebody to talk to. So you need to talk to their mind, you need to speak to their emotions, to ask them why they are doing what. Some of them do not have the mens rea, that's the intention to commit these crimes. These organizers should collaborate with other mental health professionals. You should collaborate with community stakeholders. You should also keep doing more of your awareness. Next slide. So now there are renowned NGOs. There's Ministry of Health you can work with. You can also work with MPAs, the Nigeria Psychiatric Association. You can work with Mental Health Foundation of Nigeria, Neuropsychiatric Hospital. There are a lot of people you can work with. Next slide. So this is the end of my slide and I want to thank you very much. And I'll also tell you that just to cap everything, I was in the girls' school in Duce, and they called me. I'm also a certified coach. They called me that a certain girl wants to commit suicide, and these things are because they have been abused. So I really thank the organizers of this meeting, and I also look forward to working with them to reach out to so many people to take care of their mental health, because I know that there's a lot of mental health collaboration intersection to crime. If we're able to cut down or able to treat or talk to people on how to take care of their mental health, I am very sure that we are going to curb the amount of crime we see every day. So thank you, ma'am. Thank you so much.
Thank you so much. I call you Professor Nina. How are you? We really appreciate the lecture you have given. And I need us to also appreciate the other two speakers who have done wonderfully well, because they are not paid. All of these are free of charge. It only takes a good mind to be able to give time and energy towards a program where nobody is earning a dime. They are also contributing to humanity, and that's what we expect all of us to do. Now, what we wanted to do is to spare a little time and maybe money for data, and we're even offering to give data to those who cannot afford to have data, because we want to be able to touch on as many lives as possible with this program that we have, and many others as well. So we are willing to support, we are willing to help, and we open our arms to welcome those who actually will be willing to work with us in this journey. Because why I believe this is expedient is because from what WHO has told us, over 50 million Nigerians actually have mental illnesses of different kinds. So if what proportion is that? If we're 200 million, that means ratio 1 to 4. So people around you, so many of them have mental illnesses that you don't even know. And then for those of us who have opened our minds to learn more, we also need to search ourselves and be sure that we are not going into it, or that we are not in the situation right now. So thank you so much, Mrs. Raji. We really do appreciate the time you spent. We thank you so much, Professor Tariq and Dr. Nina as well, Barrister Nina. We really do appreciate and have enjoyed it. But you left some questions behind, and we expect people to answer in the room. But we need actually people to speak out at this point, please. We need just maybe in the next few minutes, if you have anything to say or if you have any question, please just go ahead and let us raise your hand and let us call you so that you can make your contribution. So Felix, I think you can handle that.
Yes, Professor Adeogun has something to tell us. Please go ahead.
Yeah,
please go
thank
ahead,
you very
Paul.
much. Yes, thank you very much. Are you hearing me?
Yes, we can hear you. Yes.
Oh, very good. Let me first of all thank the organizers of this program. It's very relevant and is quite appropriate. At the same time, I would like to appreciate the speakers, the three speakers, for the way they approach the subject. But I would like to point to one or two things from the theme of this particular program. When you say mental health, I think it's very general, because all of us will have mental, but it doesn't mean that we are sick or we have disorder. So in approaching this particular subject, I think it should be, around mental disorders or mental illness. I don't think we should apologize to anybody by describing that, because that is exactly what it is. If you say mental health, if somebody is happy, is doing his job very well, is progressing in his duty, is a brilliant student in a class, and being a pilot, a doctor, and doing very well in life, it's still part of the mental capacity to do that. So when we say mental health, that is good mental health. But when somebody is sick or has illness or has something, a disorder in his brain that is making him to depart from the normal norm, then we can talk of a mental illness, mental disorder. So because I listened to Madam Mutarayo Raji, she put everything together from the way I understood her, without distinguishing that if a child is very brilliant and is doing good, it doesn't mean that it's a mental it's a mental health problem. You understand? But rather, I want us to focus, because these are people that can be helped. People that have mental issues, like schizophrenia or any disorder of the brain that can make somebody misbehave. Then I listened to Dr. or Professor, I can't remember his name now. He was talking about the past, that we should not live in the past, but we should be concerned about the present, and then not bother ourselves about the future, because it can affect our mental health if we are looking back or if we are looking forward. But we should be concerned about the present and enjoy it. I would like to slightly disagree with him, because if you don't look at the past, then you lack experience. So to really manage yourself properly, you need to learn from what has happened to you or what has happened to somebody before. Then the present, you organize yourself so well that you don't fall into all this trap of mental illness, like taking drug, abusing, marijuana, and all sorts of things like that. Then the future is also very important, because if you don't care about your future, then you have nothing to fall on when you get there, because these are all related, they're extension of each other. So for our mental health, to maintain that status, we need to be very, very careful about what is happening to us now, so that we don't get into trouble in the future. For instance, if somebody is smoking presently and is enjoying it, then tomorrow is going to develop a series of sicknesses. So I think we should mind our past to learn what we are going to do in the present, and then prevent us from falling into trouble in the future. So that is my that's my understanding of that. So in conclusion, I seriously appreciate the last speaker from the way she approached. It's very academic, and I think if your organization can, partner with her, then I believe you are going to make a more impact in the community. But let me also say something, that this topic that you are approaching is a very huge project, very, very huge, because you are talking about 50 million out of a 200 million. Then that is more than the population of probably 2 or 3 cities together in Nigeria. Then how do you approach that? It's a very huge problem in our hand. But then it's good that, we approach it, we start it little bit by bit, and then let government be aware of this problem, or you sensitize government more and more, so that probably, this is my own suggestion, even though there are psychiatric hospitals in Nigeria, maybe they are not enough. Then they should also put in place mental health hospitals, which is also psychiatric hospitals. But they should focus on all these little things that can happen. If a child is having so much tantrum that you are afraid that, this can lead to a big problem for this child in future, a child can be taken to that kind of a hospital. That can be children psychiatric hospital or mental disorder hospital, not necessarily mental health hospital. So, and I would like to make a little addition to what she said about tying people up, or jailing people for so long, not talking to them. If you know the way some criminals behave, some of these criminals, they have been completely damaged before they are even arrested. And mental issues are not issues that can be medically, resolved permanently. A lot of efforts are going on to address it, but it's always difficult to eradicate what has gone wrong with the nerves, with the synapses in the brain. So most of them, the way they behave, they can even kill the soldier, the police. They can kill the prison warders. So they can be very, very violent. So that is the reason why most of the time they need to be confined, they need to be restrained. And these are people you cannot even communicate with, because they don't want to even listen to you. So, but if they see those ones that are still, amenable, then they can use that approach that he mentioned. But I'm afraid there are a lot of them that are irredeemable. They are not irreparable. They cannot be changed from what they are. Of course, in Nigeria, our situation is very difficult and different from what you find abroad. A lot of prisons abroad, some of the prisons are even better than 5-star hotel here. So, and when you get to that kind of environment, you calm down. And I remember Professor Lambo, late Professor Lambo, the man that established Arrow Hospital in Abeokuta. He did something. If you enter Arrow Hospital, he planted flowers beautiful flowers, so that even if you have mental disorders, by the time you are getting in there, the beautiful environment will calm you down a bit. So these are some of the approaches that can be recommended to the authority to expand it in other psychiatric hospitals, not only in Arrow, So these are my few contributions, and I want to thank you for making this program available, and I believe that you have a successful outing next time. Thank you.
Thank you so much, Professor Adiogun. We really appreciate you. Thank you so much. Felix, is there any other person who would like to say something so that we round up and we come together again in 2 weeks' time? So does anybody have something to say?
I'd like to find out if, I don't know if Ajala is Mr. or Mrs., but Ajala had something to say. If you still have something, you can let us know. It has actually been a very great time with everybody here. In fact, my notepads are full, like literally full with all the diverse perspectives, different angles, different professionals, looking at things from different perspectives. And it is something that we really appreciate. The truth of the matter is, if we wanted to stay here for another 4 hours, we could actually do so. But then we have to go back to our happy homes, right? We have to continue with our families. We really, really appreciate the time that everybody has spent here. Words are not enough to say thank you. More than 95%, and I'm not even mincing words, more than 95% of the people who joined us at the beginning of this call are still here in this call, and we appreciate it. So Ajala has something. I'm sorry, I don't know if that is made of it.
Yes. Sorry, sir. I actually wanted to make some comments, but my fear has been allayed with the last comments, with your last I will put it now, the comment that you raised. So the only thing I will say is I thank the organizers for this wonderful opportunity to learn, to be exposed again to the problem, the challenges of mental health we are having in Nigeria. So I wish the organizer the best, and all the resource person that have delivered lecture, and the eminent person that made comment last. I really enjoy it so much. God bless you all. Thank you so much.
We appreciate you. I was able to recognize your voice there. We really do appreciate everyone. Okay, so Felix, you are seeing the back office. What do we do now? Summary, and then we close for the day.
Of course, yeah. So it has actually been a wonderful, wonderful, wonderful session. Like I said earlier, we could go on and on and on, thanking people and looking at different perspectives and diverse points of views. But then we have to go home, right? Our president mentioned earlier that this is not the last time that we'll be meeting. We'll be having this session at least 2 times every month. That's bi-monthly. So every 2 weeks, we're going to come together. We're going to look at different perspectives of mental health. As some of our speakers have mentioned, this is not a very small issue. This is a serious matter. This is serious business. It's a serious concern. Some people have called it a scourge, but we are not intimidated. We are not afraid to confront the matter head on. Instead, however, what we're going to do is we're going to take it bit by bit, look at different angles, look at different points of views, look at actionable points that different people can take, the different roles that each and every one of us play, from the seemingly least person to the greatest people, to people in authority, to people in responsible positions who can take action. Every one of us has the power to make a change. We want to invite you to reach out to us. Check our website, PUWI.org. That's PUWI.org. It's showing on most of your screens now. If you have your phones handy, you can visit us. You can support this movement in cash. You can support in kind. You can be even one of our next speakers. If you have something exciting, intriguing that you think that most people would benefit from, we would be happy to hear you. We want you to reach out to us, connect with us, ask more of your questions, and of course, we'll push them to the facilitators, to the speakers who have spoken at this program tonight. 2 weeks from today, when we meet again, we are going to continue, and it's going to be another insightful session. Thank you so much, everybody, and do have a lovely night.
Yeah. Thank you so much. We appreciate everybody. I just wish to wish all of us a beautiful night so that we'll be fresh for tomorrow. But we should take home. I'm sure most people have jotted down things and we have a lot to take home. But me, I just want to chip this in briefly in 1 or 2 minutes, that don't go into any addiction, because from Professor Tariq's lecture to us this evening, we have learned that addiction starts with pains and ends with pains. Once you are in pains and you want to get out of it and you go into addiction, you reverse back to pains, perhaps greater pains. So we should attack the problem heads on. And that is why we need to seek for help when we need help. We shouldn't keep this to ourselves. We are available, and many people are also available to listen to whatever problems that individuals have. Or if you need help for your children, please do not keep to yourself. Go out to look for help so that it doesn't go beyond what we can manage and becomes a societal issue. So we need to look at this and also know that we need to slay the dragon in us, because we feel the pain inside and we are the only one who can actually kill the pain by taking the right steps so that we will be able to live a better life. We appreciate you all. Please let us come together again 2 weeks' time and we treat other topics under this mental health. It's been said that is very wide and broad, and there's no doubt about that. And if 1 out of 4 Nigerians have mental illness, it's a problem that we have in our hands that nobody is paying attention to. So we have decided to take this up. We need your support to be able to succeed in this initiative, and we appreciate you. God bless you all and good night. Thank you. My own